All right. So welcome everyone to the 2023 Interprofessional Case Competition. We thank you so much for your participation, whether it be through voluntary participation, course project, service project, or just out of the goodness of your heart of loving geriatrics. We're really excited to have you here for this yearly competition that is sponsored by the Gateway Geriatric Education Center, also through our Workforce Enhancement Program grant, which we will discuss a little bit more later. So many of the skills that you're learning and involvement is a major part of our grant this year, as well as for just the development of geriatric skills across the university. So we're excited to have you here. We will be recording this orientation so that those who can't make the orientation tonight can play back the recording to get some details of the competition. You can also contact us with any questions you may have. We will have some information for you to contact us. But before we get started, we'll give some introductions to the leadership team. Allison, you want to start us off?
Sure, I'd be happy to. Hi, everyone. I'm Allison Gibson. I'm a new associate professor in the School of Social Work. I am brand new. This is my first semester at SLU, and I'm very excited to be joining you all. Marla, would you like to introduce yourself?
Hi, everyone. Welcome and thank you for participating in the case competition this year. My name is Marla Bergwager. I serve as the Executive Director of the Gateway Geriatric Education Center, where the Geriatric Workforce Enhancement Program grant is located. And we started this competition back in 2016 actually we used to do it in the spring. And so we're excited that this has continued on. And I'm glad that all of you are with us, and a special thank you to the coaches who are all doing this on a voluntary basis. So thank you for that.
Matt, you want to introduce yourself?
Hi, I'm Matt Pitchin. I am the project coordinator for the GWEP grant, and this is my second year being involved in the case competition, and I'm excited to have another successful year.
And I'm Elena Osterber. I'm an associate professor in the Department of Clinical Health Sciences at SLU. And I was a coach and I've been a judge, so I'm really excited that all of you are here as well. Okay, let's keep going. So big thanks to Matt, who was our lead scheduler of the event, organizing teams, as well as corresponding with students, coaches, and judges. And then Marla Bergwager, who is our communication lead with the University of Minnesota and the development of materials, setup, and coordination and PI of the GWEP grant. Allison and I, we are members of the steering committee, and we were able to provide some updates to the handbook. And of course, we want to thank the University of Minnesota's GWEP members, Chris Talley and Teresa Schecker. So this is our 8th year, is that right? Or did you say, is this our 8th year, Marla?
Yes, sorry, I was muted.
Okay, no.
It is our 8th year, yes.
Okay, yeah, so it's a great opportunity that we think for all of you to interact with other disciplines and learn more about what they do, but also put together a plan for a complicated case and to have fun and to enjoy the process. There's going to be a lot of great interdisciplinary work, and we're going to be as excited as coaches to help out, and there are cash prizes. Hello, isn't that good? So this is our 4th year, and correct me if I'm wrong, Marla, working with the University of Minnesota on the InterGWEP.
Yes.
Okay, so right about that, good. So Minnesota won the first year, we won the second year, and Minnesota won last year. But again, it's fair competition for all, although we hope to win this year. Okay, guys?
We do.
Yeah, go Billikens, right? Or go geriatrics, actually. Okay. So in addition to our introductions, we would ask that students and coaches put your name and discipline and year you are in school in the chat. And we'll talk about the breakout rooms in a little bit, but feel free to get that chat rolling. And again, just name your discipline and year so we all know who's participating in the competition, so we can all feel involved. So our goals for orientation tonight include meeting the leadership committee, which we just met all 4 of us, as well as your team and coach. You will get a chance to talk during the breakout group with your team and coach, where you can learn more about each other's focus and expertise while you are also reviewing this really interesting case. I think you'll love it. You can talk also about what discipline experience you have working in geriatrics with older adults as well. We feel that we have a great case and have worked long and hard on getting diverse disciplines and health interest in there. We emphasize that the teams meet often and confer with their coach. In this competition, students teams seem to do better when they meet more often. That's not to say you have to meet many times. We know that sometimes it can be very challenging in scheduling and finding a time that you can all meet. But if you make it a goal and a commitment and put some effort into the case, you can really show great rewards. And of course, if you have any questions, put them in the chat box anytime during our presentation tonight. Okay. So, HRSA Geriatrics Workforce Enhancement Program core areas. So the HRSA Geriatrics Workforce Enhancement Program core areas include the age-friendly health system, wellness and safety, and these are two big areas that we cover. Marla leads all the initiatives on our GWEP grant and trains and educates not just students, but also professionals and providers across the state of Missouri. And now we've really been hit nationally and internationally, so this is great. The last two core areas are really the part of this competition and fit within our mission of the grant and the GEC. So education and interprofessional training, along with developing a future healthcare workforce in geriatric care. We've had many past students graduate who comment on how valuable this case was, even if they weren't on one of the winning teams. They say that working with an interprofessional team has been extremely helpful in their practice. Now to the geriatric case competition. Okay, so we have, is it 13 strong teams this year? Matt, is that correct? 13 teams?
Yes, that is correct. So we've got
Okay.
a robust group.
Yeah, it's great. Most of the teams have 5 different professions represented, so that is really awesome as well. So each team has been assigned to develop and prepare a plan so that when you present this to the judges, you can have a comprehensive plan of care. Also talk about how you work together professionally. A reflection piece for the last 2 minutes or so of the presentation. Please, we like to hear how you feel about your presentation and also the process of putting together your case. Your faculty coach will be available for consultation as needed, so feel free to consult with your coach if you have any questions. And also, if you have questions for us, you can always contact us as well. Your team will have approximately 1 month to develop your plan. Sounds like a long time, right? But trust me, when 2 weeks go by, you only have half the time left. And then you'll want to meet quickly and whip up a plan, and that is usually not a good thing. So tonight, if you can work with your team, find a way to meet. There's lots of different ways to meet these days, group chats, apps, etc. So please make sure you make a plan to meet with your team members. Okay. So the disciplines participating in the competition includes medicine, nursing, dentistry, occupational therapy, physical therapy, pharmacy, social work, medical family therapy, psychology, speech, language and hearing, nutrition, and physician assistant. So what are the competencies? So obviously working together in a climate of mutual respect and shared values is something that we honor. We have surveys that we will be providing links in the chat at some point during our orientation tonight. We'll also do a post-assessment as well after the competition is completed. We're also tracking the knowledge of your own roles and that of other professionals to assess and address healthcare needs of older adult patients, the ability to communicate with others and apply relationship building values and principles of team-based skills and team dynamics, You're not just creating a nice plan of your discipline, but also a comprehensive plan that is honoring not just the family system, but you're honoring the cultural, financial, sociological, and the socioeconomic pieces of where the family are situated. These are important things you want to make sure that you're incorporating. Okay, directions. Allison, you're
Yes, thank
on.
you. So just a reminder to folks, in order to participate in the case competition, you will need to complete a consent form, which I believe most of you completed when you signed up to register to be a participant in the case competition. But that is something you must complete in order to move forward and participate. There will be some additional things that we'll collect from you, I believe a kind of a pre-assessment, some different things like that. But that consent form is really, really important if you haven't already completed that. In terms of kind of moving forward, after tonight, you'll know who your teams are, you'll know kind of who you're working with, who your coach is, and it's kind of up to you to make a plan of action. So you can, work with your coach as needed, but it's really up to your team to kind of make a plan for how you're going to tackle this interdisciplinary case, how you're going to go about kind of taking the steps to decide when to meet, how to put the presentation together, what all you're going to cover. And so when we get to our breakout rooms a little later today, it's going to be really important that, take a chance to introduce yourselves, share how to get in touch with one another, and make sure before you leave tonight, you kind of know what the next step is in terms of maybe everybody's going to take a moment to review the case, and then in another week maybe somebody will be responsible for reaching out to the group, or maybe you're going to go ahead and schedule when you're going to connect next. But it's not your coach's job to kind of guide you through this process. It's your team. And so that's a really important component of this process, is that we want to see y'all take the initiative with it, and to kind of be responsible for the communication and what gets done for this. So first steps: review the case, read through it, see what kind of problems you're identifying within the case that need to be addressed. We have, been very intentional with this case. We really thought through kind of the interdisciplinary components. So you will see all disciplines represented in some of those issues for the individual and their family. It is not necessarily super evident in that, I think you guys know I'm a social worker. Not all the social work information that relates to the client is in one section of the case. You may find other relevant pieces of social work in another section. Same thing with, the medical information. Same thing that maybe the occupational therapist needs to be thinking about. So it's going to be really important that you really familiarize yourself with the case, and start to identify, what are some of the different components that are happening. From there, your team is maybe going to want to start to think about what is out there in terms of, best practices that could be pursued to really develop a comprehensive care plan for this individual and his family. You can talk to other providers and get input from them in terms of how they might approach handling a case like this. You can, think about personal experiences. Maybe family members, or you've had past clients, or maybe you had a neighbor that maybe has had a similar experience, and you can look to maybe what their experiences have been. It's not a bad idea to look at what, best evidence research journal articles might say about how to address some of these different problems that folks are experiencing. So there's many different kind of approaches you can take to really develop a comprehensive care plan for this individual. The last thing that I just kind of want to mention is, yes, it is really important to make a comprehensive plan. But if you're getting into the realm of where you have maybe, 27 different interventions for this family, that might be too much, right? So we also want to be thinking about, what are the priorities? What are kind of the main things that really would help to address these problems? We don't want to get too into the weeds with it. But we really want to be thinking about how do we address, these major issues that are really impacting the individual and their family, and how do we really embrace that patient's voice and honor what their preferences, their values would be. even if something is best practice, if it doesn't appear that it would be aligned with the patient's values, we may need to reapproach that. We may need to provide some justification for that. So I encourage you to really think about what's, realistic and going to be, what's real life for this case, if this was a real client, a real family that we're working with. Lainey, would you mind advancing us? And so what I really love about this case this year is that it is, I think, very realistic. I can think of a number of clients that I've interacted with as a social worker that things that Mr. Clausen is experiencing are pretty realistic to things that I saw my own clients dealing with when I was a practicing social worker. So Bob Clausen is a 65-year-old man who lives with his 65-year-old partner in an urban area of Missouri. His chief complaint is that he has some concerns about his memory. And so he's kind of seeking some clarification about what's going on there with his memory. He has several areas of, health and psychosocial history that affect, how he's approaching this process, his lived experience, what his life has been like up to this point. And maybe even, what his values or preferences might be as he pursues some support for a possible diagnosis and what that might look like. He did, as you'll learn, reading a little bit about his case, there's a lot to the story. He grew up in a religious family and never disclosed his sexual orientation to his family, his doctors, or his employers for most of his life. And so this is a really important detail in thinking about how comfortable he's maybe going to be with healthcare and social services. Of course, we want to think about the patient's social connections and maybe some of his resources that are available to him. That's all I'll maybe say about that, but I think that gives you kind of a sense of where you might start in thinking about, what are his needs and what might be some considerations as you approach developing that comprehensive care plan for him. So in thinking about that care plan, if we could move forward on a slide, as a team, you all are going to kind of work together to develop that comprehensive care plan. So we really want to hear, from all of the perspectives of the team members. We want to know from occupational therapy, physical therapy, dental, our medical students. We want to hear from everyone in terms of what might we do to kind of help support this patient and his family, and how might we really ensure that he will get his needs met and have the best care that he possibly can, and working with our team. I think, again, it's a good idea to kind of start by maybe generating a list of some of the concerns or problems that the patient or his family identifies, as well as maybe things you're thinking about as a professional working with this individual. And then to start to kind of, explore potential interventions and community resources, what might be out there that could potentially help Mr. Clausen and his family. And then finally, something that we'll kind of expect as part of this process is also for your team to identify an evaluation for the care plan. So really, how will you know that your care plan has been successful for this individual, for his family? Are there certain things that would help to tell you if this problem has been alleviated? If it's, to his satisfaction? Those are some things that we'll also ask you to think about. Next slide, please. So as I've kind of alluded to already, the role of the coach, is actually something Elena's going to talk about. My apologies, Elena. I got going and I didn't stop. Oh, I'm sorry, you're muted.
Okay, thank you. All right. So of course, we just went through this with the coaches earlier today, but we want to help the team. You as a coach want to help the team remain focused on the collaborative competencies for sure. And also be able to connect the team with the discipline that's maybe not represented on your team as well. And that's where you might want to reach out to those personal contacts and other professionals in the field that you're missing. Meet with students if they make a request to connect, and also advise them on any kind of available resources that might be out there. Just talk about personal contact. But of course, journal sources are always good, books, and again, individuals from other professionals. And we also want to make sure that our teams work together collaboratively. that it's not piecework, that it is a plan that is comprehensive and that looks like it's written by one voice. So help the team set up a presentation rehearsal as well so that you can get a feel of how that sounds and how it would sound to the patient as well, and offer feedback if the team is looking for feedback as well. Okay, presentation and judging is all yours, Allison.
Thank you. Yeah, so I think that was a really excellent point, is that not every team has the same representation of interprofessionals in students. So I think that's something for you to also be mindful of, is that as we kind of alluded to, if you don't have a physical therapist on your team, but there's some physical therapy considerations that need to be, reviewed and addressed, that's something where, again, you are really going to want to lean on some other contacts or resources to kind of help you with that. Presentation and judging, we have a new rubric this year. So for anyone that are my judges joining us tonight, just want to make you aware that our rubric has changed since last year. We have that available. We'll make that available to folks so you can review it. But essentially, your case presentation is going to be a 20 to 25 minute doing a live presentation to a panel of judges, followed by about 5 to 10 minutes for question and answers. So when you think about kind of, the group of you on your team, if everyone takes kind of a chunk of that, it won't be kind of so overwhelming that, somebody's doing an entire 20, 25-minute presentation. You may only be speaking for a couple minutes specifically on a section of the case plan. We really like to see that everyone on the team participates, and that can vary in terms of what that looks like. But that will be something the judges are kind of looking for, is that everyone, there's evident that everyone has participated. And then we also want you to have at the very end of your presentation a slide where you just kind of talk about the summary of the plan, and then a reflection of the experience of working on kind of the this process of professional collaboration, and what that's kind of been like as part of that process. We'll also be, evaluating how things like how well informed the presentation was. We'll go into detail here in just a minute to kind of talk about what that rubric, that criteria looks like. Let's move forward.
So
I'm sorry, Lena. It's okay.
Thank you. So check out those past competition winners, okay? These are really good models. They did win after all. There are also a lot of great informational videos on the GEC website, and the website link is here as well. There's an aging and memory clinic website at SLU, and there's also several faculty members, including Marla, and then we have Max Sabatsky, which is on here right now, have given some great talks and PowerPoint slides as well on geriatric health, loneliness, isolation, memory loss. I believe there's even some talks on hoarding and cluttering and other areas that you might be interested in, as well as like fall risk as well. So there's some great resources here for you as well. Okay, so did you want to go over this, Allison, or you want me to go ahead?
You're welcome to. That's fine.
Okay, so you will use a standardized rubric, or you will use it as well, because you want to know what areas the judges are going to be looking at. And so you will receive this rubric as well, and that is how you will be evaluated. So the patient and family want to make sure that they are part of the care team. Then when we get into the care team, who is responsible for meeting the patient care needs? So obviously having a care manager who would take the lead while also working together. So that means you might want to choose someone in your team to be the care managers. There are also several benchmarks as far as relationships between effective teamwork and also being able to improve safety and health outcomes. So obviously involving those professionals, and how you can have innovative ideas, identifying and addressing those issues. There will be plenty in the case methods for tracking treatments and outcomes of the cases as well. This is a big section illustrating the interests of the patient and family, who are at the center of the interprofessional team in health delivery. So use humanistic language. And I'm not sure we brought this up, but we should probably bring up health literacy and health equity as well. So keep those issues in mind as well. So obviously addressing the caregiver or the family health. So consider the caregiver's health as well, and as part of your plan as well. And also think about ways you can build trust with the patient. In this patient's case, Mr. Clausen, you will need to do some trust building here. Again, it's tough to meet that 20 to 25 minutes, but if you keep practice, your presentation skills will certainly improve and become second nature. Okay. So judging considerations. So once again, I'm going to say this 1,000 times, is that a copy of the judging rubric is going to be in the team folders as well. So this is a criteria that we will be looking for. Higher scoring teams will provide the evidence of patient-centered care, evidence of meeting the IP competencies, and evidence of collaboration on the plan and presentation, and innovation in your plan. So use some creativity. And I believe we might have talked about this already, but using visuals in your presentation is very, very helpful. And also it makes it easier for most of us to understand where you're going. Also include some insightful reflections on how your team worked together, and then also the evidence of use of a geriatric framework as well. Okay, other geriatric, or I'm sorry, I got geriatrics on my mind there. So other judging considerations. So the range of students and experiences, we may not have identified all of the issues we put into this case. Okay, you have a 1 month preparation time. The goal is not that all the details are right, that they have a good rationale for your recommendations. And don't worry about the details of unique profession-specific issues that other professionals would not know. And you might want to consider finances, but don't let that constrain the plan. Okay, presentation skills. So you want to hone in on your presentation skills, teams. You want to have a good, effective introduction. Then you want a short case summary. You want to be creative. You want to make sure that your presentation is organized, that it is readable, and that you have some professional visuals. We want appropriate eye contact and posture from teams, and also we'll be looking at your facial expressions and also using clear, audible voices, and that all team members have participated in the presentation. Okay, scoring. Would you like to do the scoring, Allison?
Sorry, I had trouble unmuting there. I'm happy to do that. So as
Sure,
you'll see on the rubric, the rubric varies. Some items are weighted a little more heavy than others. So you'll see some on a scale of 0 to 8, and some that are on kind of a scale of 0 to 4. So generally, obviously the higher the score, the better kind of the quality you did on that item. So we strive obviously for those excellent, those good scores. But if something is not present as part of the presentation, folks can be awarded a 0 for that item. And so if we have a little bit of time, maybe at the end of the call after the breakout rooms, maybe we can pull up that rubric and look at it together. But again, we want you to know what you're being evaluated on, so we'll make that rubric available to folks as well. So what to expect in terms of timeline. I think you all saw the initial flyer tonight, student orientation, get to meet your teams, get to meet your coach. Our presentation for kind of our local competition here with SLU and some of our local partners will take place on October 30th. That's a Monday night. We were intentional to avoid Halloween in case folks had other plans. But we want to recognize that every team will have kind of a 30-minute allotment for their presentation. There will be kind of a group of judges that will evaluate folks. Again, we're presenting these live, but over Zoom. And you should plan to prepare about 20, at most 25 minutes for your case presentation, so that we can allow for some time for question and answers following the presentation. The judges may want to ask you a couple questions, maybe have you clarify something or elaborate on something that was part of your plan. And so shortly after that evening, we'll be able to announce who our local winner was. And then so our local team will then be invited to compete again in that inter-institution competition. We call it the inter-GWEP, and that will take place against the University of Minnesota and some of their affiliates. And that is scheduled for November 14th. I think I might have a separate slide about that.
Right.
We would love for anyone to, attend that inter-institution competition, but we will be sending one team to represent kind of SLU and our local groups to represent us as part of that. And I think I saw a question in the chat about, how does that work out? We'll be there all night. No, so it's kind of luck of the draw in terms of who you get for judges. We'll have multiple teams presenting at the same time. So we may have 4 or 5 presentations happening in the same 30-minute window with different judges. Am I correct on that, Marla? The first timer should
Yes,
probably
so
not be.
you'll get each team will receive a specific time, and you will be in the room with the judges, in the Zoom room, obviously, with the judges. And there will be at least 3 rooms of judges and presentations going on at the same time. So basically the whole event on the 30th will be over in about 2.5 hours.
But for your team, you're really only concerned about that half hour that
Exactly.
you're scheduled.
Right.
Perfect. And so be thinking as you kind of go through this process. We of course always want to get feedback from folks. So as you're thinking about, even tonight, what was clear, what wasn't clear, we'd love to hear from you. We love getting questions so that we can get a sense of what we can always improve, always do better. We really want to keep this case competition going in the future. So you'll see opportunities to give feedback, and you'll also have an opportunity to complete a post-assessment about interprofessional competencies. And again, this just helps us to kind of evaluate what's going well with the case competition, what can we improve, and how can we make this kind of a better learning experience for all of our professionals and students that are involved for that process. So be on the lookout for that after sometime in early November after our competition. But fantastic questions. So Elena, why don't you give us some final tips before we head to our breakout rooms?
Okay, final tips. One thing I did want to let you know, if you didn't know what inter-GWEP meant, it is the Intergeriatric Workforce or Interprofessional Geriatric Workforce Education Program. Okay, that can be confusing for sure. I understand. So final tips: make sure you meet at least twice prior to your presentation with your team members, and also use your coach for any questions that you might have. We have some really wonderful coaches here who are more than willing to give you some assistance. You can also contact faculty or providers of other disciplines as well. We have wonderful faculty and providers in many professions: speech language, nutrition, nursing, etc. A lot of resources, research-rich at WashU, SLU, AT Stills, lots of the universities that are being represented on this call. Again, make your plan realistic, to the point, and creative, that will advance the patient and the family, both in this case. But have fun most of all. Make sure it fits all the needs and keeps the patient and the family at the center. This is a unique opportunity to learn and collaborate with other professionals and other disciplines. So make it the best you can. So personal information and forms that need to be completed. These are the 3 areas: demographic form, information, informed consent, and the self-assessment of competencies. So